When the world stood still in 2020, we were forced to listen to the silence, to the sirens, and to each other. COVID-19 was much more than a virus. It was a mirror. And in that mirror, we saw what we got right, what we noticed and ignored, and what we forgot altogether. COVID-19 changed our world. It took lives, tested systems, and taught us hard truths. But what did we really learn? And what must we never forget? Let's start with the good news, the lessons we learned. These are the scars that taught us something, the bruises that we didn't cover up, but instead we studied. We learned that strong public health systems can save lives. Quick testing, contact tracing, and clear communication helped stop outbreaks while they were occurring. Vaccines were developed in record time. We learned that science moves faster when borders don't exist. Global collaboration gave us vaccines in record time, which is a scientific miracle, but not everyone had equal access. And we learned that clear, consistent communication can save lives. Many governments now have improved emergency communication plans in place. For example, in northern Saskatchewan, First Nations leaders worked with health officials to share messages in local languages. They used radio, trusted voices, and cultural knowledge to protect their people. That's a lesson in partnership. These lessons became actions that we use to change systems and make us as a nation better. However, not all lessons were learned. Some were just observed. Once again, marginalized communities suffered more. During the pandemic, marginalized communities saw higher infection rates, less access to care, more economic pain, and we've seen it before, and we did see it again. We also saw how misinformation spreads faster than any virus. Confusing messages and false claims flooded our feeds. People didn't know who to trust, and when trust breaks down, so does public health. We also observed a significant mental health toll on community members, but we didn't always respond. Loneliness, grief, burnout, mental health as a whole took a hit and support systems didn't keep up. We observed that mental health needs to be treated like physical health and it needs to be considered essential. There were several warnings and we saw them, noted them, but we didn't always take action to fix them. And then there were the lessons lost. The ones that we recorded in reports that nobody read, the ones that we were told were going to be revisited, but they never did. We had plans, we had warnings, we had simulations. We knew pandemics were coming, but we didn't fund the support of them. Many of the countries that waited too long weren't ready, and people paid the price. Science evolves, and that's normal, but when guidance changed, people saw it as a failure. We didn't explain the why, and that's what hurt the trust. Trust isn't built in a crisis, it's built before. Without it, even the best advice can fall flat. These are the lessons that haunt us, because they were preventable, and they still are. The next pandemic is not a question of if, but rather when. So let's not just remember what we lived through. Let's act on it. We can begin by communicating clearly, using plain words, being honest, and saying what we know and what we don't. That's how we can build trust. We also need to work with communities, not just for them. Using local voices, respecting local culture. Health equity starts with listening. We also can't just observe. We can't forget. We need to act so that we're ready for the next time. Thank you for listening and thank you for your time.